Indian Medical Association Maharashtra State has proved its mettle in every aspect of medical field this year. The 2019-20 year was a really testing year. All of us were engulfed by the pandemic of COVID-19, and every member of our 45,000 members were involved in fighting against this deadly pandemic. Every branch of Maharashtra State, every member of IMA Maharashtra, and all the leaders and all the presidents of local branches, secretaries and office bearers were involved in these activities. At the same time, I am very happy that our usual academic work, our social work, we did not part with. And all this led to a very, very satisfying year, and I give congratulations to every member of IMA Maharashtra. Thank you.
Dear friends, I am Dr. Pankaj Bandarkar, Honorary Secretary IMA Maharashtra State. Greetings from IMA Maharashtra State. Friends, COVID-19 virus entered our life like a comet during beginning of 2020. We were and we are still in the process of learning about signs, symptoms and treatment of COVID-19. All our members work hard during the pandemic, keeping in mind the dharma of medical profession. We have extended our helping hand to the government right from the beginning of this pandemic, but surprisingly, we were not involved in the decision-making process, and on the contrary, we had to confront the government regarding various circular rules, regulations and capping of hospital charges imposed upon us by them. Safety of medical personnel in private practice was totally ignored by the government. I take this opportunity to offer our heartfelt condolences to the families and their members of our 65 COVID-19 martyrs of IMA of Maharashtra State. I congratulate all our members for their dedicated, excellent performance during this COVID-19 pandemic. Jai Hind, Jai IMA.
Friends, when the COVID-19 pandemic struck India in February 2020, the entire nation went into lockdown. It was a state of shock for everybody. Nobody knew how to deal with it. But we, the healthcare workers, doctors, reacted very swiftly. The IMA Maharashtra State Action Committee swung into action immediately. First, what we did, we conducted webinars for public awareness. We wrote some articles in newspapers. We wrote some blogs on the net to make the public aware how to prevent it, how to detect COVID-19. On the other hand, at the field level, we all the members, we taught our members how to work in this pandemic, how IMA member can contribute in this pandemic. We publish guidelines to use rationally PPEs. We publish guidelines for management of BMW. We published guidelines for the respiratory clinic, which we conducted all over the state. In fact, it was free of charge, the clinic. But as the pandemic started exploding, what happened unfortunately was the attitude of the government, administrative officials was very repulsive, very unfortunate, very illogical. So we had to retaliate because there were very derogatory comments on the professions. So we passed resolutions, we sent those resolutions to government, we wrote letters to government condemning those situations, we fought for the rational charges which the government was trying to cap. So we had to retaliate on this fear. And we also tried to make our members awareness about their own safety, because our members who were working in day in and day out to fight this COVID-19 situation were risking their own lives, were risking their family members' lives as well. So we had to protect them. So this action committee worked in all the spheres, right from prevention, public awareness, to maintain the safety of our members, to retaliate towards the government for the rightful, justful comments and rights of our own members. So this action committee worked for the member and as well as for the public also. So I thank our President Dr. Avinash Bonwe sir and the Chairman of Action Committee Dr. Suhas Pingre sir in this entire action of last 8 months. And I thank all the members who cooperated us. There are few exceptional good government officers also. I thank them because they supported us for a good cause, and the media also supported us for a good cause. They published our articles.
देखो, महाराष्ट्र मेडिकल काउंसिल की तरफ से भी और इंडियन मेडिकल एसोसिएशन के तरफ से भी हमने सब एडवाइजरी दी है हमारे सब मेंबर्स को कि आपकी ओपीडी चालू रखें, मगर उस ओपीडी में कंट्रोल रहना चाहिए। सिर्फ इमरजेंसी जो केसेस है वो बेसिकली देखने चाहिए। जो रूटीन केसेस है और जो फॉलोअप के रूटीन केसेस है वो आप एनकरेज मत करना पेशेंट्स को आपके ओपीडी में आने के लिए, क्योंकि वो आने से जो क्राउड हो जाता है। और गवर्नमेंट और आईसीएमआर के सब इंस्ट्रक्शंस आए हैं कि सोशल डिस्टेंसिंग रखना ज़रूरी है, तो वो क्राउड करने के लिए रूटीन पेशेंट्स बंद करें और सिर्फ इमरजेंसीज देखें। ऐसे एडवाइजरी तो हमने दे दी है, और ऊपर से महाराष्ट्र मेडिकल काउंसिल ने अभी टेलीफोनिक कंसल्टेशन करने के लिए भी सबको परमिशन दे दी है। लीगली दे कैन डू।
As we are seeing more and more cases coming up, especially in the city of Mumbai where I am based, we require to ramp up the infrastructure. So, of course, the government and the corporation here in Mumbai are doing a lot of work on it, and in advance anticipating, because that's the central team which has said 75,000 cases, positive cases in Mumbai alone by the end of May. So, we require to be ready for those 75,000 cases. So more and more setups are being put up. They are being put up in BKC, that is the Bandra Kurla complex. They have been put up in NSCI, and plus they are taking up huge hotels and marriage halls and everything to ramp up the facilities. But all this takes time. All this takes a lot of requirement of health workers also. So the human resource to be looked into it. So of course it is a huge challenge, but then we have no way out but to face this problem head on.
Do you think that more rapid testing, pool testing is something that the government should look at?
Definitely, testing is the key to contain this coronavirus spread, as advocated by World Health Organization also. And I am also happy to note that our government of India has ramped up its testing capacities, and now we are testing around 15 to 20,000 cases per day. But still, we lack on a world perspective, where per million we are still somewhere around between 150 to 200 tests per 10 lakh population, while all the advanced countries are testing nearly 1 lakh patients per day. I think testing will detect, and once they are detected, then those patients can be contained, their contacts can be traced, and proper treatment can be instituted. So there is a definite need to ramp up testing facilities. You have hit the nail. Masks are to be made compulsory, and it should start from the top. All the celebrities, all the opinion makers should wear proper fitting, regular mask all the time, everywhere. And this should not only be compulsory, but a massive public awareness campaign. And here all NGOs can chip in. Unfortunately, what we are lacking in this pandemic is the political class at the ground level is not seen as it was seen in other disasters like earthquakes or floods. If they come on to the Mohalla community leaders, the local postmaster, local school teacher, local corporator, local Shiv Sena Pramukh or its counterpart, if they come onto the streets and make aware the community, I think that will be the most effective way of making people wear masks. Masks are the only vaccine which is available at present.
ये पर्सनल प्रोटेक्टिव इक्विपमेंट ये पहला चीज है, अवेलेबिलिटी सब जगह पे होना चाहिए, जो पहले नहीं था मगर अभी काफी सारी जगह पे पीपीईज है एज पर एज मेट्रोज आर कंसर्न। थोड़ा दिक्कत महाराष्ट्र के पेरी में है, मगर वो भी मेरे ख्याल से जल्दी निपट जाएंगे और उधर भी पीपी अवेलेबल हो जाएंगे। मेरा सिर्फ यही मानना है एज फार एज पीपी इज कंसर्न कि सरकार ने पीपी प्रोक्योर करके प्रॉपर स्टैंडर्डाइज और इफेक्टिव पीपी ये सबको प्रोवाइड करना चाहिए, सब हॉस्पिटल्स को, डॉक्टर्स को। सेकेंडली, पीपी अवेलेबल है मगर स्टाफ को ये ट्रेनिंग देना जरूरी होता है हाउ टू यूज पीपी, क्योंकि ये स्टाफ जो है वो इवन इफ रेगुलरली काम कर रहे हैं हॉस्पिटल्स में, बहुत अच्छा काम कर रहे हैं, मगर दे आर नॉट ट्रेन्ड टू डील विद द सिचुएशन लाइक कोविड व्हिच वी आर फेसिंग सिंस लास्ट 2.5 months। जब हम कोविड जैसी सिचुएशन से डील कर रहे हैं, नाउ हम ऐसे टाइम पे खड़े हैं जहां ज्यादा से ज्यादा कोविड हॉस्पिटल्स में एडमिशन आने लगे हैं, कोविड आईसीयूज में, हाई डिपेंडेंसी यूनिट्स में एडमिशंस आने लगे हैं। ऐसे समय में ये स्टाफ को ट्रेनिंग होना कि किस तरह से पीपी का इस्तेमाल किया जाता है, तो क्या केयर लेना चाहिए जब आप पीपी इस्तेमाल कर रहे हो। सेकेंडली, इन्फेक्शन कंट्रोल के अंडर स्टाफ ने कौन सा केयर लेना चाहिए, हॉस्पिटल ने कौन सा केयर लेना चाहिए, ये उनके लिए ट्रेनिंग होना बहुत जरूरी है। अगर ये नहीं रहेगा तो थोड़ा बहुत कहा 19-20 भी हो गया तो उसकी वजह से ये इन्फेक्शन स्प्रेड होने का खतरा पैदा हो सकता है, और ये वजह हो सकता है कि इतने सारे हॉस्पिटल्स में स्टाफ, डॉक्टर स्प्रेड हुआ है और ये डॉक्टर थोड़ा बहुत हॉस्पिटल सील हुआ है।
आज डीएमएआर ने एक नोटिफिकेशन निकाला है, उसमें से उन्होंने प्राइवेट डॉक्टर्स की सर्विसेज मांगी है और वो मुंबई रीजन और सबअर्बन डिस्ट्रिक्ट के लिए है। ये जो भी नोटिफिकेशन है, मैं उसके ऊपर ये कहना चाहूँगा कि हमारे डॉक्टर्स ऑल ओवर महाराष्ट्र ऑलरेडी ये सर्विसेज सेल्फलेस दे रहे हैं। मोबाइल क्लिनिक्स, कम्युनिटी क्लिनिक्स, कोविड हॉस्पिटल, कोविड फैसिलिटी, कोविड आईसीयू वार्ड्स, सभी जगह पे प्राइवेट प्रैक्टिशनर्स अपनी सर्विसेज फ्री ऑफ कॉस्ट सेल्फलेस दे रहे हैं। मैं दो चीज़ें इसके ऊपर बोलूँगा कि ये जो डॉक्टर सेल्फलेस सर्विसेज दे रहे हैं, उनकी सुरक्षा की तरफ सरकार ने ध्यान देना चाहिए। उनके लिए एक इंश्योरेंस तुरंत लागू कर दिया जाना चाहिए। उनके लिए कुछ एक क्राइटेरिया अमाउंट, समझो किसी को कोविड के दौरान कुछ होता है सैड इंसिडेंट, तो उसके फैमिली के लिए एक क्राइटेरिया अमाउंट सरकार ने मान्य करनी चाहिए। और थर्डली, उनको सभी को हेल्थ केयर वायलेंस के अगेंस्ट प्रोटेक्शन मिलना चाहिए। ये मेरी मांग सरकार से रहेगी। थैंक यू।
To prepare our hospitals for COVID-19 was a Herculean task. Right from getting the oxygen pipelines done to the oxygen supply, acquiring of PP kits, N95 masks, then ventilators, BiPAP, and not last but not the least, the staff. Believe me, getting the staff on duty was really a big task. Whether it's the staff or the BiPAP machine or any of the equipment, the cost suddenly went from X to 3X. And believe me, government did not do anything for it. And this is where most of the hospitals suffered. So I appeal to the government to just look into these matters so that in future, the hospitals do not face this. The government put restrictions on the charges for the COVID and non-COVID hospital. If the government had first put restrictions on these charges and the vendors, then the hospitals would have been happy to accept the COVID charges and the non-COVID charges put in by the government. So the government needs to think before getting anything into action.
Now we are working on a post-COVID patients, wherein we have seen the difficulties faced by the patients with oxygen saturation, breathlessness, added to their earlier COPD or lung diseases. We have put 2.5 oxygen concentrator on a rental basis and giving at a very nominal rate to the patients. We are monitoring. We are going to have purchase another 5 to the needy patients in the nearby areas. Continuously, we were monitoring with the government authorities as well as the municipal corporation authorities to establish a good contact with the patients' relatives, and other thing. So I am really overwhelmed by the IMA work done during the entire 6 months period, and IMA will continue to do the good work for all the needy patients.
तो हम लोगों को पूरा जानकारी दे रहे हैं कि सोशल डिस्टेंसिंग कैसा करने का, मास्क कैसा पहनने का, हाथ कैसा धोने का, घर के बाहर नहीं निकालने का। अपना एरिया कंटेनमेंट एरिया है तो अपने को बहुत सतर्कता बरतनी है।
डॉक्टर साहब 35 साल से स्लम में काम करते आ रहे हैं और वहाँ की देखभाल में इनका बहुत बड़ा सहयोग रहा है। एंड शायद आप लोगों को पता नहीं है कि जब ये पेंडेमिक शुरू हुआ, ये दिन में 200 से 300 कोविड पेशेंट्स को टेस्ट करते थे। लोग कहते हैं कि सीनियर सिटीजन्स को घर पे रहना है, आप फोर फ्रंट में काम कर रहे थे लाइक अ वॉरियर। वाज़न्ट इट चैलेंजिंग फॉर यू?
चैलेंजिंग था, डर भी बहुत लग रहा था, लेकिन परिस्थिति ऐसी थी कि हम डॉक्टर लोग हैं, हम ये वॉर में सोल्जर है। अगर सोल्जर ही अपनी ड्यूटी छोड़ के घर पे बैठ जाएगा तो हम ये वॉर कैसे जीतेंगे?
नमस्कार, hello friends, I am Dr. Ramkrishna Londe, President elect, I am MS. Hearty congratulations to Dr. Rakhi Madam. She is doing very wonderful work on Corona pandemic. Best wishes for her new venture.